Scott's first patient of the day is a ginger tabby cat called Harry.
Good morning.
Hello, good morning.
How are you?
I'm fine, and you?
Very well. Hi, Harry.
He and his owner Roger have become regular visitors to the Richmond practice since Harry swallowed a piece of string and required emergency surgery 5 weeks ago.
Scott will be out with you shortly, so just take a seat
Okay,
for us. Okay?
thanks very much.
Bye, Harry.
Post-operative stress and complications have led to painful bleeding and bladder problems.
Hi, Roger.
Oh, hello, Scott.
Good to see you again.
Nice to see you.
Back
Hi.
again.
Yeah.
Hello, Harry. Hello, champ. All right, come on in. Let's have a chat. Come on, in you come.
Come on then. He's fine, except when he needs to pee. And he can actually get so distressed, he's rushing around trying to pee, and it won't come out except in little drips.
He's a very friendly boy, but I think he's quite sick of us as vets, isn't he?
Well, he's not really sick of you, but he'd rather not come here all the time if that's possible. But
Yes.
he's been in and out quite a lot.
So over the last few weeks, since the urinary output's been a problem, his ability to go to the toilet, tell me a little bit about how that's playing out.
Well, he is growling and uncomfortable, and he's obviously in pain.
Just want to have a little feel of his bladder.
Okay.
Good boy. Yeah, all right. Oh, so tender. Oh, you're sore, aren't you, mate? Just literally barely touching it.
Yeah.
Oh, you started to growl already.
Yeah.
Poor Harry has had a terrible time of late. He's got something called FLUTD, which is feline lower urinary tract disease. It's caused by loads of different things, but in his case, it's stress, which has led to bleeding of the bladder lining, which has then blocked his ability to pass urine. So he's had some really tough times. Oh, sweetheart. Dear, you can tell when a cat's in lots of discomfort when they change personality like that.
Yeah,
I mean, you are such a sweetheart, but that hurts, doesn't it?
After trying various medications on 6-year-old Harry without success, Scott has no choice now but to recommend a radical solution.
What I need to do to your boy is to actually remove his penis.
Yes. Well, if that's going to make him better, but what would the result be?
Well, ostensibly, this is a sex change operation.
Yes.
So he has his penis removed, and then the urethra is then folded outwards to become basically a vagina.
Yes.
But by doing so, it should have a larger opening, and then the cells that have been clogging up at the base of his penis will now be able to be passed more easily, and the threat of kidney damage would have waned.
Yes.
We'd much rather Harry be healthy without his penis than with it and
Yes, quite, yeah.
unwell.
Well, if that's the solution and we've tried everything else, that's the only thing to go ahead with, so that's what we'll do.
Scott will schedule the confronting surgery for later today.
Hey, you love your daddy, don't you? Not so big a fan of us, are you, though? Yeah.
Tug. Come on. I'm going to win this.
Close by in Twickenham, Justine is having playtime with 9-month-old Rosie.
And floppy ears. Should we do floppy ears?
Rosie is a cross between a Springer Spaniel and a poodle, which is, they're known as a sproodle.
You a good girl? Sometimes. But sometimes I still roast chicken.
She means everything. We've only had her a short while, but she soon has become part of the family.
I give her treats without Daddy and Mummy looking, and I give Rosie my socks without Daddy and Mummy looking. That last one kills me.
The boys absolutely love her. Harrison, my younger son, is really very attached to her and has been known to give her his socks to chew, which is fairly disgusting.
He's like a big furry cushion.
However, underneath all that fur, Justine is worried about a problem with Rosie's eye.
It's your massive eyelashes, isn't it?
I noticed recently that one of her eyes had become red and inflamed and was discharging. It looked to me like a conjunctivitis, like just an infection.
So in that corner you can see it's bright white, but the other side is much pinker and more inflamed.
Justine's about to take her sproodle to Scott for a second opinion.
You're all right, girl.
I'm hoping that it's something, that's easily treatable.
Good girl, Rosie. You excited to go to the vets?
As a human doctor, she knows all about the risks of surgery.
I have been told that for small puppies, going under anaesthetic can be quite challenging, but I'm an anaesthetist myself, so I'm sure she's in very good hands.
Hi, Justine. How are you?
Hey, good, thank you.
Hello, Rosie, the happiest dog in St Margaret's. How are you? Hey, how are you? She's an amazing dog, this dog. She's like a walking perm.
She is. She is.
Straight out of the 80s, you are. Hey, aren't you? Come on in. Come on.
Good girl. I know we're going. Hey, come on.
While Rosie appears to not have a care in the world, Scott soon discovers this happy sproodle does have a problem.
It's very red and irritated, isn't it, sweetie? Okay. So I can see she's got a little bit of discharge there.
Yeah, that's been a bit worse, I'd say, the last few weeks as well.
Okay.
Yeah.
Okay. This eye actually is also a little red, the right eye. Not as bad as the left, but it's definitely redder than I would like.
Okay.
Irritation of eyes in dogs can be caused by loads of different things. Usually it's something environmental. For example, it might be some sort of grass or it might be some sort of pollen. Oh, it's pretty cool. What's that? What's that? Oh, wow. Well, that's not something that you see every day, Rosie. Wow. Just look and see.
All right.
Okay, well, what she has is something called a dermoid cyst. Incredible, really, in this dog that she has so much hair on the outside of her body that she's decided to actually grow some hair on the inside of her eye.
Okay.
So,
I knew she was talented.
well, that's taking talent to a whole other level.
Dermoid cysts are not caused by the environment. Instead, it's a rare condition dogs have from birth.
Rosie would actually be feeling quite irritated indeed. When you've got hair rubbing against the cornea, which is the protective surface of your eye, that can be really quite painful, so we definitely need to do something about it. I think we should think about removing them. It's very, very delicate surgery, and it is does come with risks like any anaesthetic does and any surgery does.
I'm not worried about the anaesthetic. I'm an anaesthetist, so I'm sure.
You're an anaesthetist?
I am. I'm sure she's in great hands.
Wow, the nurses are going to feel the pressure.
No pressure. No pressure.
Mum's an anaesthetist.
Rosie will be scheduled for surgery tomorrow.
Does that sound all right to you?
Rosie? I know she's in good hands, but obviously, as a pet owner and lover, I am obviously concerned about her. Kiss. There are always complications with every procedure, and this is no exception, I guess.
Bye now.
Say,
Take care.
see you later.
Look
Say
after
bye,
her.
Mummy.
Take care.
See ya.
Say bye.
Oh, that was another puppy for Scully to play with.
It's a beautiful day, and Scott's wife Zoe and her friend Nicole are enjoying the sunshine at their local park. While Zoe's girls Summer and Quinn adore their poodle cross Scully and have absolutely no fear of dogs,
Go on, give her a stroke. There we go.
Nicole's son Zach is not so sure.
Zach loves animals. A little bit timid with dogs, though, but I think he really wants a pet, and we've been thinking about it for a while for the family. So I think it's really key that we find the right one for him. So I think he'd love something to be responsible for, look after. I think it'd be great for his confidence.
Yeah.
And I think he'd really love and care for it, but it's just kind of thinking what's the right thing. Dogs aren't the right pet, so we need to think about what pet we could get him. I can't have cats, you know I'm allergic.
You're allergic, yep.
With a dog or cat out of the equation, Nicole has asked Zoe for other suggestions for their first family pet.
We were talking about it a little while ago, and I started giving it some thought, and actually one of the nurses at Scotty's vet practice, a guy called Nathan, he has a sort of plethora of various pets. Yeah, I think he might be the go-to guy, actually.
That would be great.
Yeah. I know the kids really well, I know the family really well, so I think I can really help. And of course, I've got Nathan that I can turn to, and he's the guy who knows everything. Leave it with me, my love. This could be quite exciting. I know.
Just no snakes, though, hey.
No snakes?
No snakes.
All right, Dad, note to self, no snakes.
Yeah, thanks for that.
Harry's back again.
What's that face for?
Well, today Harry's going to have his penis taken off.
Right. Okay.
Assisted by nurses Emma and Nathan, Scott's about to start the radical surgery to try to fix Harry's painful bladder problems.
Unfortunately, buddy, less than 1% of cats that have this condition need this very nasty surgery. It's got to be done, I'm afraid. The main issue is that his urethra, the tube from the bladder to the outside, is spasming. It's tightening up, which means that he can't pass urine normally. So unfortunately, what we need to do is something akin to a sex change operation and increase the diameter of the urethra to allow him to urinate normally.
Harry should be pain-free after the surgery.
Good boy, good boy.
But right now, the 6-year-old isn't feeling particularly grateful.
Oh, what a noise.
Sleepy time now. The issue here is that if his urine continues to get blocked, the kidneys can be irreparably damaged, and that can lead to kidney failure, and Harry could pass away from that.
I feel a bit intrusive.
Well, it's very intrusive. I can't think of anything more intrusive. We have to deal with uncomfortable things as vets all the time. For Harry to live comfortably, he needs to live without his penis. And as much as that's horrific to consider, it is what we need to do. Okay, everyone ready? Harry's happy?
Yeah.
Okay, very good.
Wow, that's quite incredible.
It's a complex procedure. There's lots of nerves around the site, and you can get lots of complications after the procedure if you don't do it properly. So at this point, I feel confident, but still a little nervous. A few butterflies. I'm at the point now where I have got his sort of internal willy external. Okay, so now the suturing begins. It's just so fine, so delicate, and one little mistake, 1 millimeter one way to the other can be a real issue for the cat. And now I have to say goodbye to his willy. I need to cut it off. Sorry, mate.
Scott is now using a catheter to test if the new opening is big enough.
Yes, look at that.
Nice.
That is probably almost 3 times the size of the tube I put in originally, which shows that 3 times as much stuff can come through that tube before it blocks, which is an exceptionally positive outcome. That's awesome. That is awesome. Okay, so.
Good job.
Yep, let's wake this chap up, or cat up.
He's still a boy.
He's still a boy.
Harry will be closely monitored overnight to make sure the operation has been a success.
You're such a good boy, eh? You're always going to be a good boy, yes you are. Yeah.
In Isleworth, Scott's wife Zoe is on a mission to find a very special first pet for a good friend.
Hey, Nate.
Oh, hey, Zoe.
How you doing? You all right?
Yeah, good, thank you.
You're the man I need today.
Yeah, so
Many women say that to you.
With dogs and cats ruled out, Nurse Nathan, who is the practice's exotic animals expert, has brought in some other potential candidates.
Got a good selection.
Have you?
So yes, let's go downstairs and have a look.
Let's do it. Nathan's a smart guy, so I think he's going to come up with some pretty cool animals for me to have a look at today. I trust Nathan. He would come up with just the pick of the crop. Right, Nath, what have we got?
I thought about this one first.
Okay. Whoa.
Maybe something with no legs, but no fur either, which I...
Okay. I'm not sure it really ticks the cuddly box.
The snake's an African house snake. It's a really good starter snake, really pretty, really good to handle.
Do you know, I'm not 100% sure Nicole, Zach's mum, is gonna love me for bringing this into her life. Zach is only 5 years old, and this would be his first pet. I am quite nervous. What else have you got? Go on.
close your eyes.
Okay.
Scott said you were going to absolutely love this one.
Okay, Nathan, I'm getting nervous.
Are you ready?
Okay, ready.
Open your eyes.
Nathan, is that a real spider?
It's
Is that a real spider? Answer the question.
sort of a real spider.
Nathan.
It's actually the shell of the spider.
Okay. A definite no to it being a pet. For Zach, I babysit there sometimes. 8 legs, it's a goner. It's off the list. Okay, what else? I trusted you, Nathan. Go on. Oh, okay, a tortoise.
Yeah.
Oh, that's cool. I thought you, oh, wow. How cute.
The tortoise has come from a friend who's looking to rehome it. I really want to find the right home for it.
Boy or girl?
This is a boy.
Hey. But size-wise, is this as big as he'll get, or?
They do grow a little bigger, but they're not a giant tortoise. I think I'm onto a bit of a winner here. Great little tortoise called a Herman's tortoise, really commonly kept, and is a great starter tortoise as well.
Hey, buddy. Does he have a name yet?
Gil
Gil. He's so cool.
is pretty dinosaur looking, which
Yeah.
I'm sure Zach will love.
I reckon this is a strong contender, Nate. You're doing well.
With the decision made, Zoe has decided the little tortoise needs a makeover before she delivers him to Zach.
Da-da-da! I've set up for the spa.
Yeah, this is a tortoise spa and not a zoo spa.
So I think he's gonna love it.
I think you're probably enjoying it more than he is, but...
Maybe a little bit.
Yeah, let's get some cotton wool and we can give his shell a bit of a clean.
Okay, cool.
He's going to really enjoy this warm bath now. It just helps with all the movements. This would be a really good thing for Zach to do.
So once he was lovely and clean, next stage, it's a mani-pedi. And Nathan actually did say manicure. I loved it. Hey, look at you.
He's all ready to go now.
So we just need to go and get your home all set up.
Come on, let's go. Come on, Mew. Let's go. Come on.
In Richmond, another of Scott's regular patients, 4-year-old Mew Mew, has arrived with her owner Karina.
How are you?
Great to see you.
Likewise. It's been a while.
Little one.
Karina's been a client of mine for many years, and Mew Mew I've been seeing since she was a puppy. So what's been happening with this little madam?
Well, her legs got a lot worse.
We found out probably a couple of years into her life that she was suffering with a lameness to her left leg, and it seemed that her kneecap was popping out a little bit. Well, let me have a little look at you walking, madam. Shall we pop her back on the lead?
Yeah, I think so.
Scott diagnosed the Yorkshire Terrier's problem as a luxating patella.
Let's go. Come on.
Girl. Luxating patella is basically where the kneecap pops in and out of the joint. And over time, that can cause a dog to be lame, they can actually skip, and worst case scenario, they can develop arthritis.
Come on, Mew. Come on.
All right, well, wow, that's significantly worse than the last time I saw her, isn't it, baby? Hey, that skipping looks cute, but it's not normal. All right, let's go into the consult room and have a little feel, shall we? Come on then.
I'm very worried about bringing Mew Mew in today. I had a sleepless night last night.
Just hold around the shoulders there. I'm just going to have a little feel of this knee and just see what we're dealing with here. All right, sweetheart. All right, yeah. Oh, yes. So what I can feel very clearly is her kneecap popping in and out. If you give me your index finger and just put it in between my thumb and finger, now feel this. Pop out.
Ooh, I can't believe that. You can really feel that. Oh, poor Mew. What's been happening to you?
The concern with that is the development of arthritis. That rubbing in, out, is going to cause arthritis. And at the moment, she's a young dog. We're hoping she's going to live at least another 10 years. But if we keep allowing that rubbing to happen, she will develop fairly significant arthritis, and that will have a major impact on her comfort. Mew Mew's knee is probably a 4 out of 5 as far as the rating system for a dislocating patella. It lives almost all the time out of the groove. And so that means it's really pretty bad. And she is now limping more and more. It's causing her more pain, more discomfort, to the point where she's not even climbing stairs anymore. We are looking down the barrel of a fairly major surgery, and obviously the anaesthetic is risky because she is a little dog.
Yes.
But I'm just hoping that she's going to be as brave as her mum has been lately.
Can't hope, you have to be sure.
Okay.
Surgery on Miu Miu will be yet another challenge for Karina, who has been fighting her own life-threatening illness.
Unfortunately, I've had a bit of a battle with esophageal cancer, which is not a very well-known cancer, and it's been a long treatment of chemo and then chemo with radiation and then a major 12-hour surgery removing my esophagus. So I've really been through the mill in the last year.
Well, I'm very sure, knowing you, if she's anything like you and she has your resolve,
right,
then she's going to be just fine. Karina's an incredibly brave, strong woman, but you can tell that there's a little bit of a tear in her eye when she comes to handing over her little princess Miu Miu. She really doesn't want to let her go.
What do they say? Parting is such sweet sorrow. Oh, Miu Miu. Oh, she doesn't want to go. I am very nervous about the surgery for Miu Miu. I'm going to be sitting on the couch, looking at my phone and my watch probably every 5 minutes, waiting for the phone call to say that she's okay.
Now you're going to miss Mummy, hey? But Mummy is an inspiration, okay? And you need to be brave too.
I'm liking this little coat here.
Oh, yeah? Is it your kind of style?
Do you think I could pull it off?
Well, I think at certain venues, yeah, you could. It's very fancy, isn't it? Hey?
Nathan will be helping Scott as they attempt to fix petite Miu Miu's dislocating kneecap.
There you go, sweet pea. There's a little bit more added pressure on me today because I know what her owner Karina's been going through. She's been diagnosed with a nasty form of cancer. She's had masses of surgery and she's on a long recovery process herself. So the last thing I want to do is add stress to that. So I want to make sure that Miu Miu's surgery goes without a hitch and she can go home to her loving mum without any problems. Okay, so let's get cracking. There's not much of a groove there, is there? It's kind of flat. I can see that the trochlear groove, the groove that the kneecap sits in, is a little shallow and it does need to be deepened. But the difficulty when performing surgery on a tiny little dog like Miu Miu is she's built like a bird, really, so fine, so delicate. These bones can break very, very easily. This is the saw that I'm going to use to cut the groove with. And being a tiny little dog, there is very little margin for error, so I do need to make sure that I get it right. Steady hand. A few millimeters, one direction or the other could be a real problem.
Clinic, Scott's operating on tiny Yorkshire Terrier Miu Miu to try to stop her back left kneecap dislocating and avoid the onset of arthritis.
I need to make sure that I'm very careful deepening the groove that we're making for Miu Miu's knee because her leg is pretty much no bigger than the drumstick of a chicken. It is so tiny, so I just need to delicately take a little bit more and more of the bone away, replacing the wedge, and by doing so, working out exactly when it's deep enough, but not too deep, and so the knee will sit in and stay in. So I'm at the position now where I've deepened the groove. And then now, the knee cap is now going to pop in there. Dunk. And it fits like a glove, Nathan. It fits like a glove.
It's always good to hear.
Yeah. After completing the procedure, I can feel that the knee is sitting perfectly in the groove. You can't even push it out anymore, even with pressure of my thumb. Done. One fixed knee. All good. Let's wake her up. Still lots of work to do. Yeah, lots of physio and hydrotherapy. Can you think of this dog in a bath? She'll be the definition of a drowned rat, won't she?
I think you could use a kitchen sink instead for a hydrotherapy.
I think so. It'll be like an Olympic-sized swimming pool for this dog. This is a long recovery process, and Miu Miu will need to learn how to reuse her leg. Good girl. That's it. She'll start with things like physio, the things that Karina can do at home. And it'll be a really interesting process because I know that Karina is going through her own major recovery right now. And it might be quite cathartic to go alongside her little dog as well. There you go. All right. Have a little snooze. Good girl.
Hello, Kirsty. I'm fine. How are you?
Good, thanks. Come to pick up Harry.
Yes, we're looking forward to seeing him again.
Oh, I bet. Should I have a
Owner
seat?
Roger is
We'll be
back
with you
to
in a
pick
moment.
up his ginger tabby cat.
Hello, mate. Hello, handsome boy.
24 hours after Scott performed radical surgery to remove Harry's penis.
Where is he? Where is he? There he is.
Oh.
Hey.
Hello.
There you go.
Hey. It's good to see you.
Hey.
How are you?
Yeah, he's looking at the door, so...
Oh, he wants to go, I can tell, yeah.
Hey. He's doing so fantastically well, Roger. I mean,
good.
literally the day after the surgery, he's now able to urinate a full bladder of urine.
Great.
He's no longer uncomfortable when I feel his tummy.
Yeah.
He's eating well. He's just doing brilliantly well.
Great.
Harry has been such a fantastic patient. He's responded beautifully. He's completely comfortable. He's just a very, very happy cat. He's just doing all the right
And
things.
he's desperate to go home and we're desperate to have him there.
I'm sure.
Yes.
I'm sure you are.
Yeah.
Roger is such a gent. He is such an old school man, but you can tell he loves this cat and he's just so happy to have Harry back in his arms. It's great to see them both back together again. You take care and keep a close eye on that back end for me.
I will.
Make sure he's weeing for England. All right? Bye, buddy. All right, we'll see you soon.
Thanks a lot.
Okay, bye now.
Bye-bye now. See you soon.
Bye, chaps.
Bye. Bye.
Bye.
Zach? What's this for? What's this table for?
Not remember.
You're not sure?
No.
Is it for a surprise?
Yeah.
What do you think that surprise is going to be, buddy? What's that? The door?
In Twickenham, Zach, Dad Ian, and Mum Nicole are making final preparations for the new addition to the family.
Zoe.
Is he excited? He's really excited. Oh, cool.
Scott's wife Zoe has been helping her best friend Nicole to find the perfect first pet for her 5-year-old son.
You're not excited about anything, are you, Zach? Yeah. Maybe a little bit? Maybe about what I've got in this box?
Oh, yeah.
Zach's been wanting a pet for a long time, and it was really a few weeks ago that Nick said, we've really got to think about this. You know, what's the right pet for us? In the middle.
Whoa.
Got a shell. What is it?
A tortoise.
It's a tortoise. It's for you, buddy. I think Zach was a little bit overwhelmed. He wasn't quite sure what to expect, but you could see he was really excited. And I think as the day goes on, I think he's just going to be so stoked to have a new little pet in the family. He's coming out to say hi, Daddy. Pop your other hand around here so you're holding him on the other side.
Awesome.
Be gentle with him.
Oh.
Just put him in, and then see, this is going to be his new home, isn't it?
Wow, look,
He
he's having a
likes it, doesn't he?
stretch.
It's a huge dream come true for Zach. He's been talking about having a pet for absolutely ages. So to have this opportunity and for Zoe to help us out, it's been absolutely brilliant. We've got to make it so it's nice and warm for him when he goes to sleep.
Zach's really taking the responsibility of setting up the home, made his bed and giving it food, ready to give it a little drink. So I think he'll be the real proud owner of the tortoise and look after it really well.
It's heading to the water. I really love my new tortoise.
One girl with good hair, meet another girl with great hair.
she's got great hair.
Look at that. Hey?
At St Margaret's, Scott and head vet nurse Emma are getting 9-month-old sproodle Rosie ready for surgery.
So she's got some dermoid cysts in both eyes. She's got hair growing and rubbing against the corneas. So she's going to be in a lot of discomfort, but she acts like she's not.
Clearly.
Don't you? Hey, you're very happy. I think Rosie is aware of the hair in her eye because she's clearly irritated by it. But dogs are so fantastic, they're not hypochondriacs. And so she is being her normal, happy self despite what would likely be a large degree of pain. So how are you feeling about this anaesthetic today? Feeling confident you got it all right?
I hope so. Why?
Well, you'll be feeling a little bit of pressure when I tell you what the lovely owner of Rosie does for a living.
Oh, don't. She's an anaesthetist.
She is an anaesthetist.
No.
Yeah.
Really?
Uh-huh.
I definitely feel a bit of pressure knowing that Rosie's mum is a qualified anaesthetist. Veterinary nurses, we do a variety of jobs and anaesthesia is only a small part of that. So I'm feeling the pressure today.
So that's a hair follicle there. And then there's a hair there.
Dermoid cysts are a condition that occur in animals at birth, and Scott needs to find out if, over time, the hairy cysts have damaged Rosie's tear ducts.
Looking at this now with Rosie under anaesthetic, it's actually going to be a little bit trickier than I thought because the dermoid cyst is so close to the tear duct going down to her nose. So it's going to mean I'm going to have to be very, very careful about removing this aberrant skin on this left eye.
Scott is now using a coloured dye to find out whether the tear ducts are functioning properly.
What I've done is to put some stain into the eye just to see if the duct is working as a tube and that it's draining tears from the eye into the nose. Okay, well, it's very interesting. Both tear ducts are blocked. So she is able to produce tears, but they can't drain. Rather than them emptying like through the drain of a sink, they're bubbling over the rim. And so that's why she's got chronic and ongoing eye discharge. It's very interesting. These dermoid cysts, they've irreparably damaged or even have stopped the proper development of Rosie's tear ducts. All right, come on, Rosie. Good girl. So you can see there's the hair. All of that needs to come out. I need to make sure I take it out deep enough because the follicles go quite deep, and if I don't, the hair will just grow back. So. There's one, so you can see very clearly how much hair is on that thing. Look at that rubbing in your eye.
After initially suspecting the cysts were blocking Rosie's tear ducts, Scott makes a remarkable discovery.
There is no duct. So this cyst, unfortunately, has developed in the place of what would be her tear duct. So Rosie can't cry and absorb those tears in the normal way and then come out through her nose. In fact, they're always going to come out her eyes. So she will have some leaky eyes. It's sort of be ironic, actually, because she's probably one of the happiest dogs I know, and yet she's going to look a little bit like she's crying all the time.
Bless her.
Yeah. The dermoid cyst on the left-hand side was maybe like about 1 centimetre, maybe a bit less. The right-hand side was about half the size. Hairy blighter number 2. Both of them had hair follicles and, of course, actual hairs growing out them. Very, very weird, very abnormal, not something that you see every day. Let's pop you back in a kennel and call your mum. Yeah.
You looking forward to seeing Rosie?
2 hours later, Rosie's owner Justine and her son Harrison arrive to pick up their sproodle.
I'm a little bit nervous. I think Rosie's going to be quite groggy. She has had an anaesthetic before and she was pretty drowsy after that.
Hello!
Oh, you've got a comedy collar.
She has. She's got the cone of shame on. Hey.
Why does she have that again?
To stop her scratching her eye.
Stop her scratching her eye, exactly what Mum said, yeah. So, very interesting findings. No duct. So, that sounds terrible, but in fact, she's lived a whole life without those tear ducts. It just means that you will see a bit more overspill. So, even though you've got a very, very happy doggy, she's going to cry a little bit. So, you just need to give her lots of hugs. Sound good? Yeah?
Just need this.
Like that, just like that.
Just like that.
It's always a lovely moment as a vet when you can reunite a pet with an owner, and Harrison and Justine are there, very, very happy to see Rosie, which is wonderful.
Scott will check up on Rosie next week to make sure the sproodle's eyes have healed after the operation.
Are you going to look after her for me? There you go, young man.
Careful, darling.
See you later. Always off.
Thank you.
See you later, guys. Bye, Rosie.
Just be careful. Thank you.
See ya. All the
Scott.
best.
Bye now.
Bye, guys.
Bye-bye.
Bye, Rosie.
Bye.
Bye.
Come on this way. Thank you.
Oh, come on. Gonna go home. Going home to see Mummy.
The day after major surgery on Mew Mew's dislocating kneecap, Nurse Nathan is helping Scott with a checkup to make sure the terrier's well enough to go home.
Ah, that dog suits you, Nate.
Thanks.
Yeah, it makes you look really masculine and blokey. Hello, beautiful. Let's have a little look at that leg, shall we? Hey? Good girl. So, Isn't that incredible? Already putting the leg down. Yes, good girl.
You're very strong, aren't you?
You are, just like Mum. Let's have a little feel.
She's not even bothered by you doing that either, is she?
You're so tough. Eh?
Scott is completely satisfied with Miu Miu's recovery, but before she is released to her doting mum, there's still one more thing to do.
Make it look all beautiful so you can go home to Mummy, eh? Karina is always an incredibly well-groomed lady, so I thought the best thing to do is to groom Miu Miu as well. Oh, look, she looks like now she's out of the Muppets. I was thinking, like, if I did a central parting, that might be a bit old school, a bit Simon Cowell, so I just did a side parting. Yeah, hope that's okay.
I bet Karina's really looking forward to getting her back.
Oh, yeah. Hey, maybe that'll put a smile on Mummy's face because you look so ridiculous. Hey? Come on, let's go see Mummy. Here we are. Karina's not doing so well today with her cancer recovery, so I thought, you know what, I'm going to take the strain away and take Miu Miu down to Karina's house. Hello!
Hello, look who's here, my little Miu Miu. Oh, it's so wonderful to see you coming.
Oh, look, are you happy to see Mummy? It's great to see Karina's face light up when she's reunited with Miu Miu, and it must be a huge relief to have her back in her arms, and I can tell how much she's missed her.
Yeah, wonderful hairstyle.
Yeah, well, look, I'll be honest,
adorable.
it's not my forte.
Oh.
Fixing knees is, so
Yes.
let's go in and chat about that, shall we?
Okay, let's go.
Come on, you.
I'm so delighted that Scott brought her home and that she's already putting her leg down. I mean, that's just fantastic. So yeah, it's a huge relief and a weight off my mind.
So what I'm going to do in the early stages of recovery is just
Yes.
ask you to lift the other leg, the other
Yes.
hind leg, off the ground, and that just makes her put that leg down, all right?
Okay.
Sort of hold it up for 5 seconds or so and then down.
Okay.
And do that maybe 5 times. If
I'll
you do
just do
that a
it
few
fast.
times across the course of the day, that will just start reminding her, yes, I can use that leg.
Okay.
Before I used to skip, it felt weird. Now it's going to feel a little bit sore, but that will get better and better over the coming days and weeks. She's doing so well already, and with her young age and fighting spirit, I expect she's going to bounce back really quickly and be back to normal in no time.
I think she's
trooper.
so motivated to chase squirrels.
Oh, do you think?
She will definitely do this just for that opportunity.
Squirrel therapy.
Yeah, squirrel therapy.
She has shown that strong things come in small packages, a little bit like a mum.
Oh, thank you.
So
Can
I
you
would
hear
say,
that?
yes, just like
Do you
Mummy,
hear
actually.
that? I always think, oh, Miu Miu is so good.
And I'm hoping that, you know, over the coming weeks, as she recovers, that, you know, you're going to recover as well. And
Yes,
I'm
we'll.
going to have 2 healthy, beautiful girls on
Right,
hand.
we'll do our physio together.
Please do.
Okay.
Please do, yes. All the positivity can be shared.
Yes.
And pain hopefully halved.
Can I hold her now?
Go to
Come
Mama.
on.
There's Mama.
There you go. Oh, Miu, it's so nice to have you back. Yes.
What a duo. 2 strong, brave, and beautiful girls. And hopefully next time I see them, they'll be well on the road to recovery.
Now it's your turn, Miu. Huh? Now I can look after you because you've looked after me before. Huh? Is that a deal? Is that a deal?
Hello, Roger.
Oh, hello, Scott. How are you?
Great to see you.
It's good to see you.
I've come to see your lad.
Great, and he's waiting to see you. Come
Cool,
on in.
thank you.
Okay.
It's another home visit for Scott. This time he's checking up on Harry and his owner Roger. It's been a week since Scott removed Harry's manhood to fix his painful bladder problems.
It's a bit of a nervous day coming to see Harry because although a required procedure, it's not a nice one, and any bloke watching this would go, ouch. So I'm just hoping that Harry doesn't hold it against me. Well, he seems very healthy and very happy. How's he been since the surgery?
He's been very, very well indeed.
Yeah, I mean, the key to success is actually having him urinating less often with larger volumes.
And that's exactly what's happening.
That's absolutely perfect.
Yeah, he's a very happy lad. He's completely over it and jumping around all over the place, back to his old self again.
Oh, what's that for? Okay, well, I suppose that's
Harry.
fair enough, isn't it? Hey? Is that fair enough? You're getting one back on the vet. I did remove your penis, so I think that's probably fair.
Where you going? Where you going?
Good boy. You're a lovely boy, yeah. Hey?
There's another patient Scott wants to catch up with, 9-month-old sproodle Rosie.
Hello, wow, hello. Hello, sweetheart, how are you? Hello,
Hello,
Justine,
how you doing?
All right. Good. Mwah.
Come in.
Thank you very much. Come on, you big hairy critter, let's go. Good girl. And how have things been going since the surgery?
Really good, really
Yeah?
good. She had a little bit of discharge, but it's all sorted itself out now.
Let's have a little look. I mean, they certainly look much less red and no more weird hair growing inside the eye, which is advantageous, isn't it?
That's got to be better.
Yeah.
Rosie's eyes have healed perfectly well. There's a lot of blood supply going into the area, so it does heal very quickly. The suture now needs to come out, and that should be the end of surgery for Rosie.
Should we get Mummy to take the suture out?
Yeah, let's do it, Rosie. Let's do it. Are you going to let me do it?
Yeah.
A trained anaesthetist, Justine spends most of her working life in an operating theatre.
Got to be still, Rosie.
But not with a surgical instrument in hand.
Normally, human patients stay quite still, especially if you're going towards them with something sharp, whereas I suspect Rosie won't be quite so still.
Mummy, very, very still. Yes, there it is. So all I need to do is just pull up one side of that suture and then slice the other side. Well done. There we go. Yay!
Hey.
That wasn't too bad.
How hard is it to be a vet?
How rude.
I think Justine's very happy with the result with Rosie. All she wants as a loving owner is to have a dog that's free of discomfort.
You've been a good girl. You smart, hey? She is full of life. She looks good, but hairy.
Oh, are you happy? Hey? Are you happy? Yeah? Yes. Oh.
I'm very excited today, Mimi.
As for Karina and Miu Miu, the chic duo are both back on their feet again.
Yes, we're nearly there, I know you're getting excited.
It's been 2 months since Scott operated on the Yorkshire Terrier's kneecap,
Come on, Miu.
and she's now allowed to go out for regular walks.
Hello, Miu Miu. Hello, Karina.
Hi, Scott.
How are you?
I'm good, and you?
Very well. Hello, gorgeous girl. Well, it's lovely to see you two in the park again.
Yes.
And how are you going, little madam? Hey?
Oh, you've got a kiss.
Ooh,
You're
wow,
lucky.
that's nice.
Oh, I think
That's
she might be
nice.
allergic to you. She's sneezing.
She's allergic to vets. I think it's fair enough.
While Miu Miu has been recovering from surgery, owner Karina is continuing her battle against throat cancer.
How are you getting on?
Yeah, I know. I'm definitely slowly but surely on the road to recovery. It's, I have good days and I have bad days, but I think there's a general movement in the right direction.
In
I think
the
Mimi's
upward
having a
trend.
good day.
Both have been through major surgery in the recent history. So it's really nice they've got each other to rely on, have a bit of a cuddle, and to keep each other on the straight and narrow and on that path to recovery. And it's been a few weeks now. She's sort of starting to walk a little bit better, jumping and playing with squirrels again.
Yes, no, there's no problem with all her running and jumping, and she's definitely not restricted in her movement in any
Certainly
way.
not.
She wants to
Hey? Yes.
go and chase some more squirrels. Have
Well,
you?
you're both very diminutive but very strong females.
Oh, I like that.
Bye-bye, beautiful. Mwah. See you later.
Right,
And she's off. It's always great to catch up with owners and happy, healthy patients after they've recovered from surgery. But Miu Miu's very keen to get off and enjoy the park time with her mum. So it's great to see them walking off into their future together.